Okay, so I've got a question for you, Christina, and this might be a tricky one. I get asked this all the time, and I'm sure you get asked it more than me. What can you see as a person with albinism and nystagmus? What is it that you see?
So that's the $1,000,000 question that everyone asks me, that I really struggle with, because as I've said before, what I see is very normal to me. So if I ask somebody with normal vision what they can see, they would find it hard to describe as well. But if I were to try and hazard a guess just from what I know is wrong with my eyes, I would say that I don't think I see detail in the same way that other people do. And if I try and see detail, it has to be like there in front of my face. I don't see the world move because of my nystagmus. The way I see absolutely kind of affects what I do with my eyes. So I move my head. If I were to look at something, I generally don't move my eyes to look at it. They don't do what I want them to do, and I think they wobble more when I try and move them. Like, I think when people cross the road, I think they look left and right, but they also move their eyes, whereas I really don't. I really literally have to move my head. Then photophobia comes into it, and that massively affects my vision, because when I'm outside, I see, I think, just really bright, and it makes it so I can see like shapes of things, but I can't see what they are. And then if I go in and out of shadows, that's really hard because my eyes can't adjust quick enough. And at night time, we've talked about it before, but I can just see black and like the headlights of cars. But I think generally it's the detail thing, if I were to explain it and describe it, that I don't see. Some kind of like impressionist picture, maybe. Mm-hmm. Can you help me decipher what I can see?
Yeah, it's a good question, isn't it? And it's really hard to ask anyone what they see when that's what they've seen their whole life, right? And it almost goes into the kind of philosophical age-old question of, well, how do I know that what I see is green, you don't see as red, if that's what you've always seen? But I think there's a few things. So when I talk to parents who ask this question a lot, when there's new babies with diagnoses, I think the important things that you've mentioned already are super key. So, for example, most people with albinism and nystagmus will not see the world wiggling 99.9% of the time. There might be times when occasionally they do, when they're tired or stressed, but most of the time they're not seeing the world move, even though their eye is moving, which is quite amazing if you think about it. What that probably means is that if your brain is switching off your vision whilst it's moving, you're probably seeing the world to some degree in snapshots, separated in time. So a bit like stutter vision is one way people have described it. So, for example, if I threw a ball across your vision in front of you, I would potentially see all the moving parts of that in a nice smooth line, whereas you might see it here, then see it here, then see it here. And so it's a bit like a shutter effect. That's one thing that we kind of assume is probably the case for people with nystagmus. So that may well go on to kind of explain some of the things that you've said about moving targets, complex visual scenes in the past. The photophobia thing's really important, as you said. So your vision will vary way more than mine, depending on the lighting in the room, because I have a way of adjusting for that, with my irises getting bigger and smaller, so my pupils getting bigger and smaller. And that happens obviously without me thinking about it, but you don't have that correction. Then there's the fact that your retina has been built in a slightly different way, and so your absolute ability to see tiny things and differentiate them from other tiny things is reduced, even if your eye is completely stock still in the perfect lighting conditions. So the analogy there being like a camera with a sensor in it. The sensor is just lower resolution sensor, full stop. And then over a lifetime, the important thing that we tend to say about vision in albinism is that, as far as we know, it doesn't tend to change hugely in terms of the physical structures of your eyes. Some people, when they look a bit older, have other things which start to come to play. So when you get to my age, you start to get all the normal things at my age. So your focusing is more difficult. You're having to hold things further away. And there's other elements that people do describe with albinism as they get a little bit older. But on the whole, it's a relatively static condition throughout life once it's kind of, once you're born with it and your eyes have developed fully, which is usually by the age of 8 or 9. So that would be how we'd probably describe it. But I think parents often say, well, is there a way of mocking this up? Is there a way of me looking at something and you can show me exactly what my child will see? And the answer is there isn't really. We do have things like simulators, which can say, well, look, this is what the world would look like if your eyes were wiggling. The problem with that being what I said a minute ago, that if I sit on one of those simulators now, I will see this wiggle and it will be really maddening. And that's what people with nystagmus, when they've developed it later on in life, see. So acquired nystagmus. But for people with albinism, you won't actually see that wiggle. So that kind of mock-up isn't really particularly accurate. One way of thinking about it, and one way I was thinking about the other day, is that if I deliberately sit here and move my eye left to right, it's quite hard work to do, but if I do that, my brain also suppresses the images in between those movements. It's called saccadic suppression. And I can realise very quickly that trying to do things while I'm doing that is really hard.
What do you see though when you do that? What is it like?
So when I do that, I can still, the part of my brain that's telling me what my visual world looks like is relatively similar, but I can actually see movement. So I actually see the world flicking from one thing to another, because kind of two different angles. And what that makes it really hard for me to do is to direct something in an accurate way and also look at the tiny detail of anything. It also takes me a lot longer. So in all reality, for the nystagmus part, I've found that's probably the most useful thing. Even though people with nystagmus don't see the world wiggling, it's quite useful because they will see different angles. But it doesn't appreciate the fact that overall my retina is still pretty good while I'm doing that. Someone with albinism, the retina will not be quite as good. So actually even just the resolution of what I'm seeing while I'm moving my eyes around is falsely good for me compared to someone with albinism. It's a really hard one to answer, and it's definitely not the same for everyone with albinism. There are some elements of it that are impacted by nystagmus, some elements impacted by how much the retina has developed, and that's variable in people with albinism. There's elements of how much photophobia you have, and again, we've talked about this before, but that's really variable because it depends on how much pigment you have in your eye. But overall, I suppose maybe the best summary is the world takes longer to appreciate things, actual vision is lower, and your vision is way more variable depending on lighting conditions, stress, time of the day, that sort of thing.
Is your vision the same most of the time? Like, it doesn't depend where you are or what you're doing. Can you roughly kind of see in the same way?
Yeah, absolutely. So if I move from a light area to a dark area, it'll take a second maybe. But on the whole, it doesn't really impact my ability to see unless it's really extreme. So I could get up from this relatively dark room now, walk outside, and I'd see essentially very similarly to how I'm doing inside. Also, if I'm under super stress, it will make no difference to my actual vision. Also, time of the day, whether I'm ill, all that sort of stuff. It's just way more corrected by all these things that I can do, or my brain and eye can do, that yours can't, to try and adjust for all these variables. I think particularly parents of young children are super keen to know exactly what they see. The other thing it's possibly worth factoring in is that children, particularly young babies, are not designed to see well. So the average baby's vision is really quite poor, actually, and it doesn't really get up to even driving standard probably for a year or two of life. So children are usually born very long-sighted. So there's lots of things which are supposed to be not great when you're tiny and then gradually sort of work up to normal. So it's worth factoring that in as well when we talk about what does my baby actually see.
I always think, and I don't know if it's a helpful thing to say, but I always say to people that your child, what they see is normal to them. So as a parent who's got perfect vision, you're looking at your child from the point of view of somebody that can see everything and has always been able to see everything. But if you haven't, then what you see is perfectly normal, and you can't grieve or as a person, or you can't be upset about something you've never had. But I know I don't have perfect vision, but to me I do. Like, you know, I think it's great. So I can't be sad about that. So I think sometimes to kind of comfort people when they're really feeling sad, quite rightly, that it's not as bad as you think it is, because you're coming from it from a point of view of someone that can see properly and has always seen properly.
Yeah, I totally agree. I totally agree. We have so many young children who do fantastically well in life. They just do. Again, I think a big part of that is because they haven't had fantastic vision that's suddenly gone off the cliff on a Friday night or something. This is something that they've had all their life. They've learned lots of little strategies without even realizing they have, and they go through life with that. That's what they know. So yeah, I completely agree.
And then the other thing to add to that is that I don't know for people who have normal vision, because I've never had it, but for me, my vision is like contextual as well. So what I don't see, my brain fills in the gaps, so that I know, like when I'm crossing a road, that big red thing on the road, I can't tell what it is, but I know it's big and it's red, and if it's big and it's red and I live in London, it's a bus. So yeah. My eyes aren't seeing that, but my brain is knowing what that is. And I think that sometimes tricks people into a false sense of your actual ability to see. So people, when they are surprised when they know how bad my vision is, because they're like, but you can do this and you know what that is and you know what that is. Well, I do, but that's because I've been living in this world for X amount of years and I know how the world works. It's not what my eyes see.
Yeah, completely. And I think people often forget that the vision, in inverted commas, your eyes is just part of the technology that feeds into your vision. Your vision is so much more than that. And in terms of your brain recognizing things, you know, as I said before, people with really, really low vision actually often have very well developed parts of their brain that vision normally feeds into. And the reason for that is that you use all sorts of other stuff to build up your visual scene in front of you. For example, most people could literally close their eyes. I could do it right now, and I'd probably do a reasonable job of going out the room, going down the stairs, getting to my kitchen, because my brain has formulated a 3D sort of visual impression, and vision feeds into that, but it's not the only thing. So it does make sense when you think of the whole system a bit more of your brain sees stuff, your eyes are really just one part of the camera that feeds into that.
If you've got anything else you want us to discuss or any burning questions you want us to answer, then please put it in the comments below.
And if you could press some of those buttons at the bottom, the heart ones, the thumb ones, whatever they are, apparently that's good to get people to see these videos. So please do that.